Hello and welcome to the 2024 spring meetings of the World Bank Group and IMF. We have a full room here. I'm Shakuntala Santharan, Shaks for short. Over the next hour, we'll discuss how countries can accelerate progress toward universal health coverage, where everyone, everywhere has access to quality, affordable health care when they need it. You can share your thoughts on this topic at any time using the hashtag WBGmeetings. We have experts in multiple languages standing by to answer your questions online at live.worldbank.org. Please post your questions in the live chat if you're joining us online, or by using the QR codes displayed on the chairs in front of you and around the room if you're here with us. Now, later in the program, we'll hear from ministers of health and finance, leaders in the private sector, civil society, and philanthropy to explore the issues and opportunities. First up, let's get the perspective of two people very familiar with the topic who understand what we need to make urgent progress. Please join me in welcoming Ajay Banga, President of the World Bank Group, and Dr. Tedros Adhanom Ghebreyesus, Director General of the World Health Organization. Greetings, gentlemen. Thank you so very much for being here with us today. Ajay, first, quickly, you've been doing a lot of work fixing the plumbing of the World Bank Group. Why, and what's the aim of that?
So this plumbing question is getting asked a few times, and I think that's because I made the statement that I believe that if you make the bank better and more effective, quicker, faster, simpler to navigate, then that allows you to raise your ambition on the kind of things that you can do, because your ability to execute gets enhanced many times over by the quality of your foundation. So I use plumbing to describe it because I say that you can't build a new house with poor plumbing. That is the logic. So what we're trying to do is to improve the speed, turnaround time. It used to take us 19 months to get a project approved. From the time we started talking about it to approval, we're down by 3 months. We want to bring down another 3 months by the middle of next year. If we get it down to a year, that's really good, given the complexity of what we deal with. We're trying to do things with combining our structure in different countries, 20 countries. We're going to put one country head on top of IFC, MIGA, IBRD, all together. So our client has to deal with one person, one World Bank group, and cut out some of the silos that otherwise are visible. We're working on capital adequacy, change the vision and mission of the bank to include livable planet. There's a whole series of these partnerships with other multilateral banks. We're about to launch a co-financing platform, a digital one, which will enable all the MDBs to work together on co-financing deals. We're looking at standardizing standards across procurement. I mean, I could keep going. It's all the plumbing. It's what makes the bank and its people work quicker, faster, better.
So streamlining everything.
Right.
So here we are today talking about health, with the world facing so many pressing issues. Why are we talking about healthcare today?
Because I think healthcare is foundational. I think that at the end of the day, if you look at people struggling with either the cost of healthcare or the inability to access healthcare, it leads to the worst possible outcomes. I went to Indonesia and saw the work they're doing on stunting. The reality is, if a child in the first 1,000 years of their 1,000 days of their existence doesn't get the right kind of nutrition, that has an impact economically forever for that child. They earn between 15 and 20% less every year, forever. If you look at climate change and what it's doing to heat impact on diseases, another issue. Tedros can talk about this ad nauseum, but 2 billion people in this world do not have access to healthcare in a way that they get insurance or they get it free. They end up paying for it out of pocket. That puts them in a cycle of poverty for a long time to come. So we've got to fix what is a fundamental requirement for human existence in the form of healthcare, and we have to make it available at a price that's affordable. That's not that complex to get around your head. It's hard to get done, but you will hear from the Japanese finance minister in a short while. They knew how to do it well, and that's what we are trying to do as well.
So no health, no wealth, as the saying goes. Thank you for spelling that out for us, Ajay. So, Dr. Tedros, where does the world stand on universal health coverage that you've long championed?
No, thank you. First of all, I would like to thank my friend Ajay for inviting me to this very important session. And second, I fully agree with him. Health is the foundation. And as you rightly said, health is wealth. And that's why IJI and the World Bank takes it seriously. And we're very, very glad to say this. By the way, our partnership is increasing from time to time now. We partner on UHC. We partner on Global Preparedness and Monitoring Board. We partner on Pandemic Fund. We partner on also leading the Health and Finance Task Force. You name it. It's a long list, by the way. So thank you so much for your leadership, IJI. And on the status of UHC, 140 countries have recognized health as a fundamental right in their constitution. This is very important because it's recognizing health as a fundamental human right, which is a political choice that can help us to do the rest, financing or everything. So that's good. And then the second part is since the birth of WHO, that's 76 years ago, life expectancy has increased from 46 to now 74 average. And this is good progress. Of course, this is living condition improved, improvements in medicine, improvements in public health. It's overall development. It shows overall development. So we're progressing. But if you see the SDG goals directly, if you compare it with the SDG goals, we're off track.
Yeah, very.
And I don't think without a very serious catch-up, we may even reach the SDGs. So we have to work harder, and that's why we're partnering with the World Bank and other partners, the whole UN, with countries, especially countries at the center, to push forward to achieve the SDG goals.
So partnerships clearly key. Dr. Tedros, just talk us through quickly, what are some of the key challenges to achieving universal health coverage?
So the challenges are twofold. One, in terms of service coverage, and second, financial. I think IJI had already said that. In terms of service coverage, 4.5 million do not have access to basic services. And 2 billion, IJI said it, face financial hardship trying to seek service. And even as a result, some of them descend into poverty. So that's one of the challenges. So coverage, the first one, the 4.5, but also the financial hardship, which is the 2 billion who can afford. These are the two main ones, but of course there are problems like shortage of the workforce that we need to address, and there is of course a long list of challenges.
And overall aging population as well.
Aging population, urbanization, and now with the pandemics, climate and health, because the climate crisis is a health crisis. So the major trends and problems actually that complicate the health problem.
So those are some very stark figures and daunting challenges. So Ajay, in the face of this, what is the World Bank Group doing to support countries to get healthcare to more people?
By the way, one thing I'll just answer. One thing I would like to say, the issue of, for example, workforce shortages is also an opportunity, because if you think about Africa, and Tedros is an Ethiopian, and if you think about the whole continent, the number of young people who are going to be looking for jobs in the coming 10 to 15 years, one of the ways to give them a really good job is give them the chance to get skilled to provide the kind of service that's going to be required from the investment we're going to make in the coming 10 years in this space. So he's absolutely correct. It is a problem today, but we also see it, both of us, as a way forward for young people. Back to your point, what are we going to do? The bank has been working in 100 countries for a while on what I would call maternal and neonatal kind of effort to improve the delivery of care to women and young babies. And there's done a decent job of doing so. The question really is, if you want to widen your aperture, to include the diseases across adolescence and older age. So if you just think about heart attacks, diabetes, blood pressure, those are diseases that are challenging older in life as well. And so if you want to broaden the access for those, then you have to widen your aperture to include that. And that's what we are trying to do in this effort, reach 1.5 billion people over the coming period with the WHO, with other partners, and make that happen by 2030. And reach them means really reach them. Don't just, I don't mean reach as in you put up a center and everybody in the area is counted. This is actually touching the person with a medical appointment, either physical or telehealth, working on these expanded range of non-communicable diseases. And maybe in those 100 countries, but maybe expanded geographies in those countries or new countries as well. And that's the effort we're going to try and put in by now in 2030.
So that's 1.5 billion people in essentially 5 years. How are you going to do that?
6 years, but who's counting? 6 years. How are we going to do that?
How are you going to do that?
How are we going to do that? I think it takes a lot of hard work, a lot of knowledge, a lot of financing, and a lot of partnerships. So let me quickly walk through a little bit of it. Financing is the obvious one. You know, we've got money, yes. We're a money bank and a knowledge bank. But even the money we can put to work will never be enough. We're talking about putting to work 50% more money per year than what we used to spend in healthcare pre the pandemic. You're still going to need money from governments. You're going to need money from the private sector. So let me walk you through this a little bit. If you talk about the countries that are at the lowest end of affordability, mostly IDA countries, they spend relatively little amounts of money per person, $21 per person per year on healthcare. That's not going to get you healthcare workers in remote areas that we're talking about. So we have to give them share financing, concessional and grant financing. But if you're a middle-income country, you may have more money available, but you may not have the right regulatory policies to create the multiplier that you want to create by also bringing in the private sector, but by also clarifying how to get more energy going into this space. And I think there we can help with incentivizing them through our money to create the right regulatory platforms, the right policies. And Tedros can talk to you about regulatory policies all day long, but that could help a lot. If you get the private sector involved, once they have some clarity, you could do things like focusing them on the manufacturing of PPE, manufacturing of essential medicines, something that Tedros had a nightmare of during COVID. Ask him, he will tell you. And if you could also get them involved with, for example, putting the right vitamin supplements into processed foods so that you enhance health right from the basic consumption. So there's a number of things. Some of these are more likely to happen in some countries, some in others. The point is, this financing has to be catered for the country and its stage of development. In the same way, knowledge has to be catered for the country and its stage of development. If it's basic knowledge, are you talking about putting up a primary health center or a hospital, which is better at what stage of development? Tough choice, but a conversation to be had. If it's later discussions and conversations about, does this country need geographic expansion? Does this country need new skills? Does this country need affordability? What's the logic of what that country needs to break through its barriers on delivering its share of the 1.5 billion? And that's kind of the knowledge part. And the partnership part, you know, there are a lot of people in the audience. I'm sure Gavi is here and others are here. They're all part of this game. You kind of need to bring all shoulders to the wheel. But since we've got Tedros here, he has what I would call domain expertise beyond limit, technical expertise beyond limit. What do we bring? We bring a diversification of knowledge. We understand water, we understand climate, we understand agriculture, we understand different things. We understand how those connect to health challenges. We can bring that knowledge as a partner, not just our financing, not just our ability to advise governments on regulatory policy, but our ability to help even him understand the intersections between these different causes of healthcare problems in the intertwined challenges that we're going through. So it's a long answer. It needs a lot of work. It's going to be really hard work between now and 2030. I'm sure we will make mistakes along the way, but we're determined to get this done.
You certainly got your work cut out for you, right? So partnerships, financing, and the sharing of knowledge, all vital. Dr. Tedros, what do you hope to see in global health in 5 years? Or 6 years?
In 6 years. By the way, the two things which are very important with regard to making progress are, one, a political commitment. I can add to that. Of course, financial commitment also, he had said that. Political commitment, we have 140 countries who recognize health as a human rights, and we have 140 countries who recognize health as a fundamental human right, and we hope the other countries will do. Because health is a political choice. When they do that, then the rest comes, including finance. Then the second is the financial commitment. In the financial commitment, there is a way. You know, there are finance ministers here, and we expect you to increase public spending. You know, commitment to universal health coverage or health for all, of course it's ambitious, but it's possible. One example that comes to mind is the United Kingdom. After the Second World War, when its economy was in its knees, it actually declared universal health coverage. The Lord Beveridge model started immediately after the Second World War. So economic status cannot be an issue. You can start with what you have. The key is the commitment, and then you can build up. So I think the political commitment and finance are important. Then what do I expect in the next? Of course, I said earlier, to get better or to add years into your life expectancy, and then we need especially to focus on mothers and children to reduce mortality. And it can be done. By the way, Ajay raised when I was Minister of Health in Ethiopia. Just in few years, with the introduction of primary health care, that maternal and under 5 mortality started to decline significantly. So that's what I wish in the next 5, 6 years. Still, there could be a significant cut in many of the countries, especially who have high burden of maternal and child health. And this could be done through a combination of promoting health, especially addressing the root causes of ill health, focusing on the determinants, because many of the health problems are in the food we eat, in the air we breathe, in the environment we live in, our lifestyle, and so on. And we should start from there. And the second is the access issue we said. Universal health coverage, but with primary health care at the foundation, because primary health care is key to cover the basic services. More than 80%, by the way, can be covered using primary health care. And primary health care is also the ears and eye of the health system, and it can help us to prevent outbreaks, but at the same time, if not, to detect early and manage. So investment in primary health care is key. And from my own experience in Ethiopia, World Bank was a major player in building the primary health care, which made a good impact. And of course, the pandemic, preparedness is very important, and we're investing in that. And then investment in science, data, and technology is very important. And like the World Bank, reforming WHO itself to be fit for purpose will be very important. But all this, the center is country. So what do we do at the country level, and what capacity do we build at the country level, and how do we help countries to achieve is crucial. But at the end of the day, the ownership is the countries. We're only here to help. And the World Bank and WHO, that's exactly what we're saying. And the results come at the country level. So I cannot say we'll get this result, but sure, if we can partner effectively, and if countries can commit, own, and take it as a political choice, and if we can support them to the fullest we can turn the tide, and hopefully we can achieve SDGs, because that's what we aimed for, and we don't need to have another goal. Let's stick to that and make it happen. And I'm hopeful that we can do that.
A resounding call to action. Dr. Tedros, Ajay, thank you very much indeed for highlighting not only the challenges that we're facing, but also the enormous opportunity that we can realize if people have access to quality, affordable healthcare. It's not just the individual, but also communities and entire countries who will benefit from such investments. Thank you both again. Now, Japan is a leader in the pursuit of universal health coverage and understands the level of partnership and collaboration it will take to make progress. We are honored to be joined now by His Excellency Shunichi Suzuki. Suzuki Daijin, yokoso goiso dekite koei desu. This is Japan's Minister of Finance. Dozo. Thank you, sir. Thank you. Yeah, well, Dr. Tedros.
First of all, I would like to thank President Banga and Director General Tedros for a very insightful discussion. It is my great honor to make a short statement on Japan's efforts to promote UHC. Japan has long been emphasizing the critical importance of UHC as a foundation for human capital development and sustainable growth. Japan has also been advocating that finance-health collaboration is essential to achieve UHC. For this reason, Japan hosted the first G20 Joint Finance Health Ministers meeting in 2019 at the margin of the G20 Osaka Summit. In this context, I am pleased today to see various stakeholders, including finance and health experts, meeting to discuss UHC. Japan has been closely working with the World Bank and WHO in supporting developing countries towards the achievement of UHC, including through financial contributions to technical assistance in this area. In order to further accelerate our efforts, I am delighted to announce today that Japan, together with the Bank and the WHO, will establish a UHC Knowledge Hub in Japan in 2025. The hub will support knowledge sharing on UHC, as well as capacity building for finance and health authorities. It is leverage the expertise of the bank and the WHO while drawing on Japan's experience, such as our efforts to maintain quality UHC amid an aging and declining population. At the bank, the discussion on IDA 21 is ongoing. IDA plays a crucial role in mainstreaming UHC in low-income countries. It is imperative to help them secure adequate financing resources for a well-functioning healthcare system. Japan expects the IDA 21 maintains UHC as one of the policy priorities. Today, I look forward to lively debate about the challenges and the policy efforts to achieve UHC in each country. Building on today's discussion, Japan will continue to help step up efforts to promote UHC across the world. Thank you.
Suzuki Daijin, domo arigatou gozaimashita. Many thanks, Minister Suzuki, for your important message and for Japan's continued commitment to global health. Thank you very much, sir. Thank you. And now we have 3 questions for you, our audience, here.